everyone. This is Kaylee from the Adolescent Health Initiative. So excited to be talking with you all today. So good afternoon or good morning for folks who are not on Eastern time like we are here. Again, my name is Kaylee and I'm the lead program specialist here at the Adolescent Health Initiative. And I'm really excited to talk with you all today about improving adolescent health in your community and how AHI specifically can help you meet your goals. So we're going to run down a lot of different resources or opportunities for partnership that AHI has available, and we'll welcome your questions throughout the webinar today. So just a couple of housekeeping notes. Yes, I will send these slides out with a follow-up email after this webinar, as well as a recording. So if you want to share this with a colleague who wasn't able to make it today, you can do that as well. Everyone's going to stay in mute mode or in listen-only mode throughout the webinar, just because there's so many folks who are tuning in. But feel free at any point to chat in your questions, and I will definitely get to all of those at some point throughout. So I know folks typically need a few extra minutes to log in. So I thought that we could kick off with just a little bit of a roll call. If you could type in to the chat or the question box where you are logging in from. So what state or organization you are a part of. I think that would be really cool to get the ball rolling today. So go ahead and do that, and I'll share them out loud as you type them in. We've got CDC in Atlanta, Bismarck, New York, Indianapolis. Woo! Let's see, you guys are so fast. All right, we've got Oklahoma, CDC in Atlanta, North Dakota Department of Health, Valerie Children's Village in New York, Harlem, Indianapolis, I already said, Missouri, Holland, Michigan, Ottawa County Department of Public Health, Fairfax County Department of Health, Lynn County Public Health in Albany, Oregon, Will County Health Department, Illinois, Newport, Oregon, Iowa, Des Moines, DSHS, Texas, Montana, Planned Parenthood of Michigan, Grand Rapids, Family Planning in New York, Cleveland Clinic, Nevada Public and Behavioral Health, CDC Family Planning Clinic in Ottawa, Iowa, another Texas, another Oregon, a couple of Oregons, Ohio, Grand Traverse County Health Department, Traverse City, Victoria County Health Department, Victoria, Texas, Morrow County Health District, Oregon, Will County Health Department, and then we have Ann Arbor, Port Arthur Health Department in Texas. So I heard a lot of Texas, a lot of Oregon, a couple of Michiganders like us, a couple of Iowa. So this is really cool to have such a wide-flung group of folks with us today, and excited to talk to you all. As some of you may or may not know, the Adolescent Health Initiative is based out of the University of Michigan here in beautiful snowy Ann Arbor, and we actually work all across the country, and we've done work specifically with each of these states in dark blue on our map here. So if you're in one of these states, Montana, Kansas, some of these states that are in the light blue, we may have talked about partnering at some point, but we haven't done any work specifically in those light blue states. So welcome more work with the states that we've already worked in, and looking forward to continuing to expand. So let me first just give you a little overview of AHI, if you're not familiar with our work yet. So our goal really is to provide training, technical assistance, and coaching to healthcare providers, health systems, and organizations across the country, with that ultimate goal to improve adolescent-centered care. And really our ultimate vision is to transform the healthcare landscape to optimize adolescent and young adult health and well-being. And really what I'm going to go through today in the webinar is exactly how we do that, or how we strive to do that. with the help of all of the folks that we work with across the country. So as you see, we do a lot of that training, coaching, technical assistance, resource development, with the ultimate goal of disseminating that and supporting folks all across the country to really, in the end, better serve young people in the healthcare field. So excited to hopefully continue to expand with some of you on the line today. So let's start off with a poll about some challenges that you might face. So I'll pull up the poll in just a second, but when we have done some customer discovery in the past, these 5 things are some of the top challenges that we've heard from healthcare providers, health systems, et cetera, when we've talked with them in the past. So things like it's hard to get young people in the door in the first place, that the environment might not be focused on the adolescent population. So we see this a lot with pediatric practices where it's more focused on younger kiddos and not as much focused on those adolescents, that 12 to 24 range. Oftentimes we find that providers and staff are unfamiliar with the confidentiality laws in their state. So they might not know what types of services young people can consent to without a caregiver's permission. Sometimes we hear people say that they're just not comfortable with adolescents. I don't know how many of you already work with adolescents or have had someone say, oh gosh, I could never work with that adolescent population. They're too difficult, they're too temperamental, and sometimes folks just aren't comfortable. And so that's one that we hear a lot. And then finally, we've heard that there are limited opportunities for professional development, especially for staff who are non-providers. So they don't have as many opportunities to get trained up on some of these adolescent-centered things as well. So I want to hear from you all. I'm going to send out this poll. And let me know which of these 5 challenges that we've sort of historically heard from partners and health centers that we work with are most relevant to you. Oops. Okay. I'm going to share the results here with you. So it looks like for the majority who are logging in today, that more than half are identifying that it's hard to get adolescents in the door. About 30% that the environment is not focused on adolescents. A small percent that staff aren't familiar with the confidentiality laws, and about 12% that there's limited opportunities for professional development. So I think I must have all of the folks who already like working with adolescents on the line here today, because no one chose that answer, which is awesome. We're all in the right place together. Great. So, you know, we really strive in our work here at AHI to address all 5 of these top challenges that we've heard from our customer discovery in the past, and kind of see those as missed opportunities for providing adolescent-centered care and impacting health outcomes. So you'll see as we kind of go through some of the resources and offerings that we have available for free, some of them, others, we have other ways to work together that we're trying to address a lot of these top challenges. So what do I mean when I'm saying adolescent-centered care? So I think it's nice to sort of have a framework that we're all coming from to start with. So the way that we define adolescent-centered environments is that they encompass the policies, practices, services, and physical spaces of health centers and that they are inclusive of, informed by, and responsive to the needs and values of adolescents. So when we think about that, we are looking at that from large to small, everything from the physical environment, where maybe there's posters or magazines or a charging station that really is going to speak to a young person. What's the Wi-Fi password? Things that are going to make them feel more comfortable and welcome, all the way up to maybe some more complicated workflows to create a confidential risk screening process, or what services we're offering. Are we doing same-day long-acting reversible contraception? So we really see these adolescent-centered environments as encompassing all of those different things, and how can we help folks to put in place as many of those adolescent-centered practices as they possibly can. So our process to sort of meet those goals here at AHI is that we collaborate with lots of different types of disciplines. So family med, peds, adolescent medicine, OBGYN, psych, public health, social work, but maybe most importantly, our adolescent collaborators through our Teen Advisory Council, and often utilizing the Teen Advisory Councils of partners that we work with as well to create resources, get feedback, etc. Also, our work is heavily informed by major medical institutions such as USPSTF, CDC, World Health Organization, AAP, AAFP, and SAM. So a combination of all of these different sources really have helped us to create the models and resources that we have to offer. So I'm going to show a short video. This was created a couple of years ago with support from our Teen Advisory Council. And again, this is just another way to think of what it means to be adolescent-centered. And I'm hoping GoToWebinar will agree with me as I show this. And this is subtitled as well.
Hi, I'm Julie.
I'm Brandon.
I'm Clara.
And I'm Felipe.
We're here to talk about some ways that health centers can meet the needs of teens and young adults through things like physical space, policies, and personal interactions.
There are tons of ways to help teens feel welcome. Here are some of our ideas.
For some of us, getting to appointments can be challenging.
Having bike racks outside can make it easier for when we don't have transportation.
Posting hours outside your clinic is important, and make sure you have times after school hours so students can get there too.
It can really help some of us with unpredictable schedules if you accept walk-ins.
And if we happen to run late for an appointment, please try not to make us feel like we've broken the law.
The more comfortable we feel, the more we'll want to come back, which will help us get better health care.
Your waiting room matters. It's our first impression and a place where your teen patients will have to, well, wait, but hopefully not too long.
And waiting means sitting, so why not have comfortable options for all shapes, sizes, and ages?
I know doctors' offices are for little kids, but they're for teens too.
Why not show a diversity of styles and types of artwork?
And maybe even feature some pieces by local teen artists.
I'd like that.
Real plants are great too, but if they don't look taken care of, it makes me feel like I might not be either.
Magazines are standard in any waiting room, but why not have some that are geared to teens, like 17 or Electronic Gaming Monthly?
No, I want Mad Magazine or J14. Or Wi-Fi. I'd like the Wi-Fi password posted even better.
Hey, what about magazines in other languages? Y servicios de traducción en otros idiomas sería aún mejor.
Yeah, also show that the space is safe and inclusive of LGBTQ plus youth, such as a rainbow sticker on the door.
Teens can have pretty different interests, but one thing that matters to all of us is privacy.
Definitely. Having some kind of dividers at the reception counter can help keep us comfortable when we share private information.
I've even been at a place that had a white noise machine to make it hard to overhear.
As much as we love the reception area, we're really here to get into the exam room.
Of course we expect it to be clean and professional, so what matters most is our interaction with our doctor.
This means we're getting good eye contact, non-judgmental listening, and welcoming body language.
Having a confidentiality policy clearly posted in the room really helps us feel comfortable being honest.
And so is doing check-ins throughout our appointment to make sure we're on the same page.
Remember, Not all situations are the same, and not all teens are the same. When in doubt, ask us.
Okay, so that's just another way that we tend to think about being adolescent-centered with the support of our Teen Advisory Council. So that leads me into talking a little bit more in depth about all of AHI's resources and services. And the way that I like to think about them and the way that I typically explain them is on the spectrum of low commitment, open access, free resources, all the way up to a little bit more high commitment, things that might have a cost associated with them. And for the items that do have costs associated with them, we have had multiple different partners partner with us in lots of different ways. So oftentimes it's through a grant or a contract when it comes to some of these more high commitment items that have a cost with them. So we will kind of dig into more depth about what that might look like. So on the low commitment end here, you're seeing some of our free resources like posters, starter guides, videos, all the way up to the high commitment end, which includes our adolescent-centered environment assessment process, as well as our adolescent champion model. And so I'm going to go through each one of these items just to give you a little bit of a better understanding and explanation of each one. So if you have any questions throughout, again, please feel free to chat them in and I'll answer them as we go along. So first thing, again, on the low commitment end, we're going to kind of start with the low commitment free end of the spectrum and work our way up, is our posters. So we have lots of different posters that are available. All of them are available in English and in Spanish. There's just a few examples on the screen here, all of which have been designed in collaboration with our Teen Advisory Council. So all of these are available in English and in Spanish, like I said. And if you are in need of a poster in another language, we're always happy to work with you on what that could look like. So any posters that you're interested in that we already have translated are free. You can just contact us and we'll send them to you. And that's a really easy way to help young people start to feel welcomed and like the environment is for them wherever your study might be. So we have a couple that are more health related and a couple like this one on the far right with the word bubbles that is more mental health related. So there's lots of different options. We did just get one of our posters translated into Japanese, which was a really cool process. So if you're interested in something in a different language, please don't hesitate to reach out and ask and see how we can collaborate on that. Next free, open access, easily available resource is our videos. And obviously you just saw one example of that, the drawing in a picture whiteboard video, which is one of my personal favorites. All of these are available on our website, adolescenthealthinitiative.org. Same with all of these other resources. So if you're interested in something, feel free to just go straight to the website and there's a way to contact us there as well. These videos are also available on YouTube, of course, and some of these are more specific. So we have one on the voices of transgender adolescents. We have this one on health experts meet teen experts. So these are great as a jumping off point a lot of times with your staff if you're getting people more up to speed on what does it mean to be adolescent centered, or to share on your own social media to show about how you yourselves are adolescent centered, or just for fun watching or listening when you have some downtime. Again, another free open access resource are our starter guides. And again, this is just a screenshot of a few of the starter guides that we have available. And you just, again, go to our website to download. And There are other topics as well that are not listed on this screen, so definitely check it out if that's something that you're interested in. So the starter guide is going to be like a 2 to 3 page guide on how to just dive into any of these particular topics. So for example, adolescent risk screening. It's going to have some example workflows, a parent letter that you can take and adapt for your own purposes, and also like the justification about why screening adolescents and about risk behaviors is so important, and then some really concrete things to consider as you're putting a practice like that into place. So those are really great if this is something that you're looking to implement or that you're currently implementing and you want to kind of take a look and see, is there anything we're missing from this process? Is there anything better we can be doing when it comes to chlamydia screening for adolescent patients? What could that look like? Or shoot, we've had a lot of parents pushing back on, universal chlamydia screening at our site. Well, there's a parent letter that's in that starter guide that you could use to inform parents in advance. So just some little tweaks and tips like that when it comes to a lot of these different adolescent-centered practices that you might already be doing or hoping to implement at your site. Again, free to download on the AHI website. The next resource is, I would say, probably one of our staff's very favorite resources to recommend and to share with folks, and those are our Spark trainings. And so those are 15 to 20 minute mini trainings that again are free to download from our website, and they're on all sorts of different adolescent-centered topics. So there's just a few examples on this slide: being youth-friendly, the confidentiality laws one is really popular, cultural humility or cultural responsiveness. But there's a whole menu of different topics on the website that I would definitely recommend you take a look at. So the kind of history around the Spark training is when AHI sort of first got our start, we were wanting to do some training with providers and other healthcare staff members. And we were asking some of our local partners here at Michigan Medicine, how much time can you give us? Can you give us a full day, a half day? Like, what will work with your schedule? And the provider we were working with said, well, we can give you 5 minutes with our staff, which we know time is so critical and everyone's time is so busy, especially in a busy clinic or in a health center. So we couldn't do things in just 5 minutes, but we thought that 15 to 20 minutes seemed like a great way to spark some learning and conversation around some really critical topics. So these aren't meant to be all-encompassing trainings, but it's a way to at least get staff sort of starting to think about some of these things, getting people up to speed on a few things that they need to know. A couple of the topics that I'll call out specifically, again, is the confidentiality law Spark. So that's going to be specific to the state that you're in. We do have about 15 different states confidentiality law Spark already created. If your state is not already represented on our list, again, I would encourage you to reach out to us and see how we can work together on that, because it does take quite a bit of research and asking a legal person in that state to confirm the research that we've done to make sure everything's totally accurate. But that Spark is really going to go through what can minors in that state consent to without a caregiver or parent's permission, and what are the things that the staff really need to know, and what are some of the limitations of that. So for example, a lot of times we think of sexual health services often are things that adolescents can consent to in a lot of the states that we've worked in, but HPV vaccines often are something that they cannot consent to. Again, this depends on the state, but there's nuances like that that are laid out in that Spark. Another one that I will mention, because it's one of the newer Sparks that we have, is actually a series on supporting LGBTQ+ young people. So that's a series of 4 different Sparks. It was so much content that we couldn't make it all just one, but there's ones on kind of general terms and common language, one on specifically supporting trans youth, some about the forms and physical spaces, making those responsive to LGBTQ+ young people. So again, that's another one that I would encourage you to take a look at and see if that would be helpful for your site. So when you download these Spark trainings, you're also going to get a PowerPoint, a script, any handouts that you might need, and then some follow-up activity, little posters to post around the health center to keep people thinking about the topic. And there's a bunch of different content areas on the website as well. Another newer resource of ours are our timely topic modules. And so we have 2 of those available right now. One is on cannabis use and youth, and one is on exposure to bullying. And these can be accessed by anybody, again, on our website. It's an online training module, and they are more so aimed at clinicians, but I do think that they are good information for other types of staff members as well. And the goal with those is really to strengthen the quality of our approaches and interactions with young people around these certain content areas. So what I like about them is that they're very interactive. They also include lots of video and audio clips from youth, as well as subject matter experts in these content areas. And so there's also activities involved in those. It's not just your recorded type of thing that you're watching. It's asking you to answer quiz questions and to jump in along with it in order to learn that content. And I just got a question through the chat about the handouts and the slides. So, and like I mentioned at the beginning, I will be sending out the slides after the webinar in order to send those out to everybody. And what the other question is, the session is not closed caption, so I'm so sorry about that. I know that we have the technology, but we should definitely figure that out. And I can actually look into that. Thanks so much for your question, Carol. All right, moving on. So everything that I'll just jump back for a minute. Everything that I've already talked about is free and open access on our website. And again, we've kind of been talking about them from level of like low commitment all the way up to like a little bit higher commitment. So again, the timely topic is going to take you some time to sit down, look at the training module, go through it, spend some time with it. Similar with the Sparks, those are going to be a little bit of time to prep, 15 to 20 minutes to facilitate with your staff. So that's going to be a little bit obviously higher commitment than asking me for a poster and putting the poster up. So lots of different levels of how to improve adolescent-centered care. So moving into some pieces that are a little bit higher commitment again, is that AHI does a lot of consulting, coaching, technical assistance, and training. And training includes in-person training, but also webinars that we do for partners on a regular basis. So there's lots of different topic areas that we do this training, coaching, and technical assistance on. And so I'll just run through a couple of the content areas that we have available. So everything that we've been talking today, which is creating and improving adolescent-centered healthcare environments. Another really cool resource that we have that is open access on the website too is around assessing the youth friendliness of health centers and engaging youth in that process. So we have a youth-led assessment that is available to download, which is a resource where young people can take the assessment and go into a health center and give some feedback from their point of view. And there's sort of a facilitator's guide that goes along with that, as well as a video that kind of helps to prep the youth for that process. So there's that free resource, but also we do consulting, coaching, technical assistance around engaging youth in assessing health centers. Also strengthening referrals and linkages to youth-friendly services. Sustaining and engaging a thriving youth advisory council. Again, we have a free resource on that too. We call it our YAC manual. Youth Advisory Council Manual. So that's available for free for download. But if that's something that you would want more in-depth coaching or TA on, of course, we're happy to do that as well. Providing confidential care for minors. Like I mentioned, there's the Spark on confidentiality laws. There's also a Spark training on confidentiality best practices. But again, if you're wanting to go more into depth and want to really dig in more on that, that's something that we could do coaching, TA, and training on. Same with the culturally responsive care and LGBTQ inclusive care. Another piece that we work on a lot and think about a lot is improving quality measures such as HPV vaccinations, chlamydia screening, and well visits. And as you've noticed, there's a lot of free resources that we offer around these different areas. And if you want to go in more depth and kind of dig into that stuff a little bit more, that's where the consulting, coaching, and TA could come in. Same with all of these other ones too, around risk screening, school-based health, and sexual health services. And we recently have been doing some work also on identifying adolescent survivors of human trafficking. Finally, we've just started to do some consulting as well around creating intentional marketing, outreach, and conference strategies. So if that's something that's on your radar, something that you want to work on, that's a new area of consulting that we've just sort of started digging into a little bit. Oh, and I just got a great question. So the question is about engaging youth on assessing the youth friendliness of health campaigns. So that's a really good question. I can't say that that's something that we've done in the past, although I do think that we have some really nice lenses to think about that from, but more specifically, we have specifically worked on assessing health centers with the youth-led assessment tool and some other coaching that we've done around that. Thanks for your question. So I know that these are a lot of different content areas. Again, the webinar today is meant to sort of give you the full breadth of the different types of things. So if you have questions, if you want to know more, my email address is going to be at the end of the presentation too. So let me know if you want more specifics on these. So another great opportunity that is really one of my favorite things that we do is our annual conference on adolescent health. I'm guessing some of you may have been to the conference in the past. This year, it's going to be our 7th annual conference, and it's our first full 2-day conference. So we've sort of done a day and a half in the past. So we are really excited. We're going to be back in Detroit again this year. And one of the things that I think is really unique about our conference is that it is multidisciplinary, but also that about half of the sessions at the conference include adolescent voice. And so that could be through an adolescent panel that folks are bringing their youth groups to speak. It could be some of the youth performers, like you see in the picture here. We had a couple of groups perform at our conference this past year. And that's something that we're really proud of and always wanting to continue and have that be a part of it. And so the other picture of the youth by the table is actually our Teen Advisory Council members, not the whole team, but a lot of the folks from last year's Teen Advisory Council. So they will also be there doing some sessions, tabling, and also giving an award for their favorite poster at the conference. So our Youth Advisory Council will be there, but also youth groups from other presenters and performances. So I think that's probably my favorite part of the conference is how much we strive to center youth voice in what we do. So that's April 20th and 21st in Detroit. So the next piece, and this is sort of the more commitment end of that spectrum, the farthest end of the spectrum in terms of commitment, is our quality improvement projects. And this is the part that I get really jazzed to talk about because this is the work that I do on a day-to-day basis and the team that I work with does, which are our 2 QI projects are the Adolescent-Centered Environment Assessment Process and the Adolescent Champion Model. And so I'm showing them both here on the screen together because they're similar in a lot of ways, and the Adolescent Champion Model is a little bit more of a commitment, so I hope here that it's clear kind of the differences between the 2 approaches. They are both 18-month quality improvement processes where we work on really that adolescent-centered approaches, policies, practices, environments, all of those things that I talked about at the very beginning today. They all include some pretty in-depth data collection, regular check-ins, and ongoing coaching and technical assistance. I would say the biggest difference is that the Adolescent-Centered Environment Assessment Process, or we call it the ASAP for short, is an individual site participating in that process, whereas the Champion model is a cohort of health centers engaging in that process, and they are coming together in person twice throughout the 18 months, and they're doing some extra pieces. So they're doing more Spark trainings, they're doing online e-learning modules. They have the option to participate in a MOC Part 4 on adolescent confidentiality that's included, and then they're building that community of practice. Whereas with the ASAP, they're doing a lot of the same data collection, assessment processes, getting regular support check-ins and TA, but they're not engaging necessarily in that community of practice with other health centers. It's really those individual sites going through with the support of their internal team at their health center and with us as their coach. So I want to go through a little bit more about some of the outcomes from these two models that we have. But let me know if there are any questions about either of the processes. And again, it's hard to represent everything that the ASAP and the Champion model encompass in one slide or in a couple of slides. So if you have additional questions or want more literature around these pieces, happy to provide that. So the ASAP and the Champion model include these 12 content areas. And so I won't read through them all, but you can see really that they're really encompassing of all the different things that we find to be really key in providing that adolescent-centered care. So everything from access to parent engagement to sexual health to cultural responsiveness, both the ASAP and the Champion model really dive into all 12 of those different content areas. A couple of the outcomes that we wanted to share from health centers who have participated in the ASAP in the past is that 100% have increased their capacity to provide confidential services to youth. And that's something, as you know, personally working with health centers throughout the process, that I see a lot of light bulb moments around things that they could be doing more when it comes to providing confidential care. Just some items where they might really not have thought about, oh, I could do this or I could do that to help it be more confidential. Over 50% demonstrated significant improvements in their staff and provider knowledge on the confidentiality laws and practices in their particular state. So again, that confidentiality piece being so important. Health centers have also widened their scope on reproductive health services. And health centers also saw a close to 40% increase in their ability to provide adolescent-centered behavioral health services, and kind of improving that communication and linkage between primary care and behavioral health. So those are just a few of the key outcomes that we're highlighting today. One of the data points that we collect from health centers throughout the Champion model and the ASAP are a survey of their staff and providers. And so this chart is representing how the staff perceived each other at year end versus before they had gone through the model, through the process. And this is before and after Spark trainings that are included as a part of the Champion model. So you can see some really nice increases around how folks perceive that their colleagues use positive body language, listen to and objectively consider what adolescent patients have to say, provide and support fair treatment for all, and then accurately discuss and apply those confidentiality laws. And so those are some really nice outcomes as it relates to the climate of some of the health centers that have been through the process. And then also from the Champion model, these are a couple of the patient outcome highlights. And another one of the data points that we highlight or that we collect from the Adolescent Champion model and the ASAP are youth surveys. And so this is a nice representation of adolescents reporting how they felt they were treated in their health centers before the intervention and after. So these are really exciting to see as well. So increases in their providers listening to them carefully, showing respect for what they had to say, spending enough time with them, asking about physical and mental health, and explaining things in a way that they could understand. And then finally, that was sort of the hard data, which I know is super important for us to look at, but I also like to include some other sort of anecdotal responses from the health centers that we worked with. And so these are a couple of the things that sites have reported that were, in their eyes, some of the biggest bright spots of working with the ASAP or the champion model. So things like implementing new workflows, getting folks on board in their organization to work on the project, doing the Spark trainings, making baby steps like with small wins like bike racks, white noise machines, so small things that can make a noticeable difference. Same day walk-in appointments, confidentiality practices, refreshing their well child visit, being able to offer Plan B in clinic, improving trans care, working on the MOC, which is on adolescent confidentiality, and then implementing same-day LARC access. And so the pictures on the screen, the Teen Life graffiti wall is from a site that I've worked with in Arizona. And that was one of their big wins from the champion model, was that they were able to make their physical space more adolescent-centered. And then the other photo here is from Will County Community Health Center, where they also did some physical updates to their space, and then they put those updates on a flyer to promote their health center. And that was a solo ASAP site that we've worked with. So just some nice examples of some of the outcomes that folks have seen throughout their work with us. So I know that has been a lot of different resources, different things that I've thrown out there. Are there any questions from folks at this point? So I do have one question about the cost for the ASAP and the champion model, and that's going to depend on a couple of different factors. And so if that's something that you're interested in, please email me and I can get you a quote for what that would look like. Other questions? For the champion model, here's a question: how many clinics would be ideal? So the maximum that we do is 10 in a cohort. And I would say the minimum, I always kind of pause on this because I do have a cohort that's 3, but we started with 4. And so sometimes there's dropout at the beginning because folks may have committed and they didn't check with their administration, and so there's issues with that. Or sites feel like, nope, this is not a good time, even though we want to do it right now. And so I like to start the cohort with 5 or 6 just to be safe. But I say the minimum really is 4, just because we want to build that community of practice, and 10 is the max. So 4 to 10. Any other questions? Another question: does the champion model work well in rural areas with varied needs between clinics? I would say yes. So the way that the model works is that the health centers individually will choose priority areas that they want to work on. And so the varied needs is something that's super common. So each site does not have to be working on the same goals within a cohort for the champion model. So they can really pick and choose what's important to them and what they think they can get done within the course of the model. What is nice is when we have that community of practice, when we're meeting in person a couple of times throughout the process, they're learning from each other. So it's actually really nice when some health centers are really good at something that another health center is working on, because then they can share, oh, here's how we do our confidential risk screening, or here's how we've been able to implement same-day LARC, or here's how we got our administration on board with actually putting some posters on the wall instead of just having it be beige everywhere. So I would say yes to that question. question. It does work well in those areas. The one challenge I'll say about rural areas is that when folks have to travel to get to the summit, that can be a little tricky. You know, I had a summit in Colorado in December, and we had one site that wasn't able to get there because they were rural, and the pass that they needed to drive through to get there was snowed in. But we made it work. We put them on speakerphone for the whole day and got them engaged in that way. So we like to get creative with stuff like that. Let's see, I have a couple of other questions here. The one question is, what kind of clinics do you tend to work with? The question is public community health centers, local health departments, private primary care, private pediatric. The answer is yes to all. So the model, the Adolescent Champion model and the ASAP, oh gosh, I wish I could remember the exact number of states that we've been in each. And the number of different types of sites is extremely varied. So we've worked with federally qualified health centers, private practices, university affiliated clinics, big health systems that have multiple sites across their system. I just worked with a mobile unit in Arizona, which was really cool. We've worked with family planning clinics, health departments, kind of the whole breadth of different types of sites, which again, I think really strengthens the support that they can give each other when we have variety within one cohort. Or, oh, and school-based health centers, of course. So we have actually a separate tool that we use with school-based health because it's a little bit different of a setting. So school-based health centers as well. Oh, thanks, Penny. So one of our partners who is working on the Adolescent Champion model is just mentioning in her comment here that another challenge in rural communities in small health centers is the creation of that youth-friendly space. So because waiting rooms are small, it's already packed, and trying to look for ways to put the focus on adolescents is challenging as well. Thanks, Penny, for that insight. That's so true. And again, that's the way that our coaches can kind of get creative with folks to think about, okay, if your waiting room is already jam-packed, what are ways we can kind of sneak in some cues to adolescents to help them feel comfortable and welcome? Thank you. Another question here, is there any content specific to refugee and immigrant youth? So I would say in terms of the resources that we already have available, I wouldn't say that we're an expert in refugee and immigrant youth. So that's something that if there was a resource that was needed in that particular area, that we would love to partner with someone who is more of an expert on that area in order to create something. But I'm trying to think through all of the resources that we have currently, and there's nothing specific that's coming to mind. So thanks for your question, and I think it's important for us to sort of point out the areas where we're not experts and see if there's ways that we can work with other people who really are in those areas if there's something that we want to fill a gap on. One more question. So the question is, do you do any work looking at data related to sexual risk reduction and sexual risk avoidance? That's a really good question. So with the ASAP and the Champion model, we're looking more at the health center environment and how we can make it more welcoming for adolescents. And so the trickle-down effect that we're hoping is that young people will feel more comfortable, more welcome to access services, and then that's going to have that trickle-down effect to help them get the sexual health services that they need, get the birth control options that they need, get the health education that they need. So not specifically. Of course, we do stay up on the latest trends in the data around what, young people, what some of those things are, what's going on with sexual risk reduction and sexual risk avoidance from other studies that we're looking at to inform our work, but we're not particularly researching those different pieces. Another question here, do you offer resources for youth with healthy choices with nutrition? So one of the sections on that you saw that the ASAP and the Champion model cover are nutritional health practices. And so when we work with sites around the Champion model, we do have some resources that we provide around nutrition and health coaching and support on exercise and things in that way. Not resources that we specifically have developed, but I do have some resources on hand that we like to recommend from other partners. If that's something that you're interested in, I'd be happy to share those. All right. Any other questions? Thank you. Okay, we're going to do one more poll here with you all. And just out of curiosity to learn more, I only get 5 options on the GoToWebinar polls, but I'm just curious as to what of the resources that we talked about today might be something that you would be interested in engaging in. All right, thank you. So a lot of folks are interested in the posters and videos. Highly recommend the posters. We get very excited when we see those out there in the community. So feel free to reach out to us for those. Some folks are interested in the ASAP and Champion model and the Spark mini trainings, coaching TA, and then the annual conference. So I do hope to see some folks at the annual conference in Detroit. We're really looking forward to that. And let me hide the poll here. And then finally, I would say how to work with us. Again, feel free, please, to email me or email our general email inbox. I promise we get back to folks really quickly, especially from the adolescenthealth@umich.edu email address. Or go ahead and poke around on the website, see what things are interesting to you. If you have any questions about anything there, we're happy to help out with all of that. If there's a resource that you feel like is lacking that you think we could partner on, would love to talk to you about that as well. And again, just to say, like I mentioned, a lot of the resources are free for download, but some of the different more intensive interventions do have a cost associated with them, and a lot of ways that we've worked with folks on those are on different grants and contracts, and we like to think creatively about how to work with people. So please don't hesitate to reach out if you're interested. And I'll look forward to hearing from some of you. Like I said, I will be sending out the slides and a recording of the webinar today, and I will also look into if there's a way for me to get this closed captioned before I send out the recording as well. So thank you for that reminder that we should work to be more accessible for all folks. If there are any other questions, I'll stay on the line for the next 5 minutes, but otherwise, thank you so much for your time today, and I hope that we can find a way to work together in the future. So the question is, there a certificate of attendance or CEUs? This was really more of a like an informational webinar, so it wouldn't qualify for CEUs, but if you need a certificate of attendance for some reason, I can create one for you just to prove you were here if you would like. So feel free to email me.